We spend our entire lives knowing that we can change the shape of our bodies. We see it when we work out, when we gain weight, and even when we build muscle. But what about our faces? Most of us believe we're stuck with the face we inherited, that it's all genetics. Some people might be luckier than others, and there's nothing to be done about it, right? Well, think again. Science shows us a different story. We can actually improve the structure of our face simply by changing certain habits. Our faces are made up of 14 bones. These bones aren't fully fused together. They have a tiny amount of movement. While small, this movement can have a big impact on how our face develops over time. Certain habits and lifestyle choices can lead to facial asymmetry. Humans have evolved to notice facial symmetry in others, associating it with better health. Historically, symmetry indicated fewer accidents, better health, and proper nutrition during development. It even signaled a better potential partner for reproduction. Surprisingly, while beauty standards have changed throughout history, traits related to health, such as facial symmetry, have remained constant. For instance, facial symmetry, the waist-to-hip ratio in women, and the shoulder-to-waist ratio in men have consistently been markers of attractiveness. But because humans are instinctively drawn to healthier partners. Understanding this raises the question, what can we do to improve our facial symmetry? Can we make changes that not only enhance our appearance but also our health? The answer is yes, and this video will show you how. The first thing you need to know is that improving facial symmetry is possible. The bones that make up our facial structure don't fully fuse until much later in life. This means they retain a small degree of movement for most of our lives. By taking advantage of this natural flexibility, we can make meaningful changes to our appearance and health over time. What causes asymmetry? So, what causes facial asymmetry, and how does it impact our health? Asymmetry can develop due to factors like smoking, dental issues, poor posture, or even having worse vision in one eye compared to the other. The challenge lies in distinguishing between genetic asymmetry and the kind caused by bad habits. To answer this question, a 2014 study examined 147 pairs of identical twins to determine what factors influenced facial symmetry. Since identical twins share the same genetics, researchers could identify the environmental factors affecting facial development. For instance, they found that twins who slept on their stomachs had greater deviations in their nose and mouth alignment compared to those who slept on their back or side. Similarly, twins who smoked or had teeth removed showed more noticeable asymmetry in their jawlines. Actionable steps to improve symmetry. Based on this study and other research, here are some practical steps you can take to improve your facial symmetry. Sleep position. Sleep on your back or side to minimize uneven pressure on your face. Quit smoking. Smoking not only damages your health but also contributes to facial asymmetry over time. Address dental issues. Make sure to resolve any problems with your teeth or jaw alignment. These bones can move, and while passive forces like sleep position have an impact, the real power to reshape comes from active forces. Just as muscles move bones throughout the body, specific habits and exercises can influence facial structure over time. Understanding how habits influence facial symmetry opens the door to improving both appearance and health. While some factors are genetic, many are within our control. By making small, consistent changes, like improving sleep position, quitting smoking, and taking care of dental health, you can achieve noticeable improvements. Remember, your body and face are more adaptable than you think. Start today, and over time, you'll see the difference. The role of facial muscles. Facial muscles are central to achieving symmetry. During most of human evolution, especially in the Paleolithic era, we ate much tougher foods than what we consume today. This had two key effects. First, it strengthened the chewing muscles, which received constant use. Second, it encouraged the growth of a larger, more developed jaw and a wider dental arch. Why is this important? A wider arch means more space for teeth, reducing the risk of malocclusion, misaligned teeth, and wisdom tooth complications. But today, with our soft, processed diets, we often fail to give these muscles the workout they need. This can lead to weaker jaw development, misaligned teeth, and even asymmetry in the lower half of the face. And guess what? This isn't purely genetic. It's influenced by what we eat and how we use these muscles. So, what can you do to counteract this? Start incorporating tougher, natural foods into your diet, like nuts, raw vegetables, and lean meats. Chewing these foods not only strengthens the muscles but also helps maintain the natural alignment of your jaw. The power of the tongue. Now, let's talk about the tongue. This incredible muscle does more than just help you speak or swallow. It plays a critical role in guiding the growth of your palate and upper jawbones. When the tongue is in its correct position, resting against the roof of your mouth, it exerts gentle pressure that helps the upper jaw grow outward and forward. Why does this matter? Forward growth creates a more balanced and symmetrical face and can even improve breathing by expanding the nasal passages. On the flip side, if you breathe through your mouth, due to allergies, poor nasal airflow, or bad posture, the tongue doesn't rest where it should. This disrupts jaw development, leading to an elongated face and health issues like sleep apnea or TMJ problems. Correcting habits and exercises. The good news? It's never too late to fix this. Even if you're an adult, correcting tongue posture and chewing habits can yield noticeable results. Here's how. Proper tongue posture. Place the tip of your tongue against the roof of your mouth, just behind your front teeth. The rest of the tongue should press gently upward and outward along the palate. This may feel strange at first, but with practice, it becomes natural. Chewing tough foods. As mentioned earlier, replace soft, processed foods with tougher options to engage your jaw muscles. Mewing technique. Popularized by Dr. Mike Mew, this involves actively maintaining proper tongue posture throughout the day. Combine this with correct swallowing techniques to guide the upper jaw forward and upward. Respiratory allergies. Impact on facial symmetry and solutions. Did you know that breathing through your mouth can change the way your face develops? It's more common than you think, and it's not just about appearances, it can affect your health too. Let's dive into why nasal breathing matters and how you can avoid the long-term effects of respiratory issues. The problem with mouth breathing. Mouth breathing, especially when caused by nasal obstructions, leads to poor oxygen intake, increases the risk of respiratory infections, and can alter facial development. Here's why. When we breathe through our mouths, the tongue can't rest in its natural position against the roof of the mouth. This disrupts the development of the upper jaw and dental arches, leading to a less symmetrical and less forward-developed face. Instead of growing upward and forward, the face develops downward, giving a longer, less balanced appearance. Can it be fixed? Absolutely. If you've dealt with allergies or chronic nasal obstructions your whole life, you're not alone, and there are ways to address it. Step 1. Test your breathing while sleeping. Many people breathe well during the day but unknowingly breathe through their mouths while sleeping. You can test this with a simple trick. Use a small piece of hypoallergenic tape to gently seal your lips before bed. If you wake up with the tape still in place, you're breathing through your nose. If not, it's time to work on your nasal breathing. Step 2. Train your breathing. Nasal breathing can be improved with specific techniques. Practice slow, deep breathing through your nose, inhaling and exhaling quietly. Engage your diaphragm. Your belly should expand as you breathe in, not your chest. This method increases oxygen delivery, reduces inflammation, and helps clear nasal passages. Step 3. Address allergies and nasal obstructions. Allergies and sinus issues are a major cause of mouth breathing. Improving your gut health can significantly reduce allergy symptoms. Include prebiotics in your diet, like soluble fiber from vegetables or supplements, to support a healthy gut microbiome. Avoid trigger foods, such as dairy, if you're lactose intolerant, as they can exacerbate nasal congestion. Step 4. Focus on facial development. The better your nasal breathing, the more your face develops forward, reducing the likelihood of a deviated nasal septum. Avoid habits like sleeping on your stomach, as they can increase asymmetry over time. Take action today. Simple changes, like improving your diet, training your breathing, and resolving nasal issues, can make a significant difference. Your body is more adaptable than you think. Start now to unlock its full potential.